So, Cedric, you've written a lot about something I'm not sure I understand called freestanding emergency departments. Can you explain that to our listeners, what they are and the pros and cons of those compared to, say, a hospital-based emergency room? Is one riskier than the other or more efficient? Tell us about that.
Yeah, the way I think of freestanding, and we have a ton of these in Texas. It's one of the places where they originated, I would say, or at least started the more modern proliferation of freestandings. It's everything that an ER needs to have, except there's no hospital upstairs, right? That's essentially all it is, and it's a way of thinking of me as an emergency physician having my own office, per se. As, like a primary care doctor, if they need an office, they go buy an office and they get a nurse and some exam rooms and they do whatever they would want to do there. For me to do that, I need to have a CAT scan, a small lab, X-ray machine, X-ray tech, maybe access to an ultrasound. So I have more equipment that needs to be there, which is why a freestanding ER tends to be more expensive than something like a doctor's office or an urgent care. But it allows me to do everything that I could do in the hospital. The only thing I can't do is send the person upstairs, right? So it'd be bad to go there for a trauma, like a major trauma where you need like immediate surgery. But for those things that you don't need immediate treatment for, even if you're having like pneumonia and you need to be admitted to the hospital, it's still not a bad place to be, because once you're seen, once you get put on oxygen, you get your x-ray, your antibiotics get started, then someone can look to transfer you to a hospital for the rest of your hospitalization. And, a lot of the hospitals and corporations out here have started to do this as more of like a hub and spoke type of model, where you have the motherland, or the mothership in the center, and then you have little freestanding spokes way out in different communities to try to bring people into your mothership.
Wow, there's different ways we can go with this. First question is, is it a problem for the patient if they don't know which one to go to and they need to be followed on? And then Sandy will lead in, I think, with the next question, talking about the fact that people use emergency rooms in the way that they weren't really originally intended because of the insurance thing. So let's go with the first question first, and then Sandy can hop in. But it seems like you mentioned before that a good trauma center has the ability to move the patient on, but the freestanding ones can't.
So I like to look at it from, and I wrote a paper about, or I wrote a letter to the editor about whether or not we should have freestandings in rural environments, right? When you think about it, a lot of rural hospitals are closing. Is it important to have access to emergency care that's close by, even if you don't have a full-fledged hospital? And I would argue, yes, it is, because if you think about it, most likely 5 out of every 6 patients that goes to an emergency room goes home. They don't get admitted to the hospital. And so for those 5 of 6 patients, having that facility close to where they live is helpful. For the 1 out of 6 that needs to be hospitalized, again, we're still able to do what we need to do for the vast majority of those people. Even if you're having a heart attack or a stroke, if you could get that initial treatment started closer to home at a freestanding and then get transferred in to the major stroke center or cardiac cath area, you're going to do better, most likely, than if you had to drive an extra 2 hours to get there. And I think that's the thing that people may not think about. In my opinion, having access to emergency care is the most important thing, and having access to emergency care closer to home is important. Now, do you need 5 of them on the same corner?
No.
Probably not. No. There's literally, an area, a suburb of Houston, where probably, I think it's within like a 2 to 4 square mile range, you have 6 different freestanding emergency departments, or 5 freestandings in one full-size hospital. But that's because the way Houston is set up, we have all these different competing entities. And so once one gets a foothold, the rest have to put their tentacle there too.
I would think that the having the satellite freestandings would loosen the load on the high end, if you will, the ones that really should be getting all the trauma cases, without having a crowded emergency room, with a lot of people in there. Maybe freeing up space and time and capacity for those would be useful. for what that's worth. You mentioned the number of people going to emergency rooms because they can't afford healthcare, and how that's kind of satisfying for you because you don't have to ask them questions about money. But there has been a lot in the news about healthcare costs and the U.S. spending far more per person and a higher share of GDP on healthcare than, say, Japan, Australia, Germany, but doesn't really achieve better overall health outcomes. What would be your prescription, if you'll forgive the pun, for maybe what we could do to get this under control?
Well, that's one of the probably most difficult questions of our era. And I have no problem with you asking me for policy prescriptions, because I actually trademarked that phrase several years ago.
Oh,
and
really?
blogged
Okay.
under the title policy prescriptions for a long, long time.
Duly noted. Duly noted.
I welcome that one. I would say the main thing, and we're dealing with prices mostly. So the cost of healthcare largely is due to prices. And the great late healthcare economist Uwe Reinhardt out of Princeton has this saying of, it's the price is stupid. Because no matter what it is, we're paying more per unit cost than any other country. Okay. Now, how do you get those prices down is the complex problem that we have to deal with. Because is it because doctors make too much money? I would argue not really. Is it because pharma makes too much money? Is it because the health insurance companies make too much money or the hospitals make too much money? I think if you ask any of those industries, they'll probably say, no, not really. I do think we do have a problem with profiteering in healthcare. And especially as we've seen things like private equity entering the healthcare space, we've seen that. But I ran across like a startling statistic. There's a JAMA internal medicine article that came out back in February that talked about, from these companies in the healthcare sector that are S&P 500 companies, they've given $170 billion to shareholders. And when you factor that in to the size of our healthcare economy, that's about 4% of every healthcare dollar is going to a shareholder, just on those S&P 500 companies. So how much more percentage-wise is being siphoned off for profit elsewhere? So I think that's one thing we have to deal with. I think another thing too is we probably do have some overuse, low quality care, low value care, as people would like to call it. People getting antibiotics when they have a virus, people getting whole body MRIs, like Kim Kardashian, stuff like that. That I think, do we really need to be spending our money there, or should we be spending it on other things? But how do we get those costs down? That's a really complex answer. And it may not be as simple as some people would like to argue of, let patients have more skin in the game, quote unquote, because even though you can make a reasonable decision about whether or not you want to buy one car versus another car, you can't do that when you're having a heart attack and say, well, I want this stent versus that stent. Because first of all, do you even know if you need a stent? The doctor probably doesn't know that you need the stent until you're actually in the middle of the procedure looking at the blood vessels, right? And then if the stent costs, X dollars or Y dollars, like, who knows about that? It's certainly not you, the person on the table, to be able to say, please give me the discount stent instead of the gold-plated one, that kind of thing. And so there's some areas where, having sort of price transparency will be helpful, right? We've seen this with like LASIK eye surgery and elective procedures, right? That stuff you can shop for, but you can't do that when it's your money or your life.
You are in the middle of a remarkable career, both as somebody who's an emergency care physician, but also somebody who cares about the profession enough to write about it. So you probably have some views on advice you would give young people in medical school in terms of preparing them for their generic medical career, but also specifically for emergency care. Any thoughts on what you would tell your young self as you were getting in?
Do what you enjoy doing. I think it's one of those like cliche things, right? If you love what you're doing, you'll never work a day in your life. But I think it's true. Like, as long as you enjoy doing what you're doing, then getting up and going to work will be rewarding for you. And it'll hopefully stave off things like burnout. One thing I would definitely encourage every single person that's going into medical school is to go to wherever the money is. You know, if you want to go to San Francisco because you think it's the coolest place on earth, and you know you have family there and all that kind of stuff, but then Iowa is giving you a full ride scholarship, go to Iowa, take the money. You know, because medical school is expensive. You're going to be deferring income for a long time. And with the way, you know, student loans have gone lately, it's been one of those things that you just don't want that hanging over your head. I literally just paid off my student loans like last year. You know,
Wow.
And you say, wow, it's not that bad, because when I happened to finish, the interest rate on my student loans was like 1.6%. It was so low that I gladly would have taken more money at this point if I knew then what I know now. Yeah. Because I will never get access to money that cheap ever again.
No, that's amazing.
But student loans these days are nowhere near there. And so it doesn't make sense for people to do that. And I think the third thing is when you get out of residency, you know, pay yourself first, start saving for retirement now. Because again, we've already in the medical field been deferring life for an extra 4 or 5 years. By the time you finish residency, it's going to be like almost a decade behind your peers. And now you're starting to play catch up. So at least start trying to save some money for retirement and residency. Because the last thing you want to do is keep practicing until you're, you know, 70, 80 years old, because you have to. Now, if you love doing it, great. And I took care of a 90-year-old doctor the other day in the ER. And like, I want to be like that guy one day, where, you know, you're still well enough to be up and around, moving around, and have your wits about you and all that kind of stuff. But I don't want to do it because I have to pay off some bills. I want to do it because I enjoy it.
Right. Didn't you enjoy
Sandra told me she wanted to be a 90-year-old astronaut, but I don't think that's possible.
I mean, we're getting closer.
Although we've had some pretty old people go into space, right?
well, we might have to move everybody to Mars one day. Who knows?
There you go.